Welcome to the Cybele Health Podcast, where we share science-backed tools and expert insights to empower women's health and elevate their lives.
Hello, welcome to this new episode of Cybele Health Podcast. I'm very excited today because we have a very special guest on the topic of exercise and physical therapy. I'm sure lots of us can relate to that and need to learn more. So today, joined with me is Anna Macmaster, Doctor of Physical Therapist, who is a women's health and pelvic floor PT turned Femtech founder. After years of helping patients recover and thrive through physical therapy, she founded Amie to make expert-led pelvic health support more accessible. As both a healthcare provider and a mother, she brings a unique perspective to women's wellness, combining clinical expertise with real-world understanding of postpartum recovery. Welcome to the podcast, Anna.
Thank you so much for having me. I'm so excited.
Sure, yeah. So tell me a little bit about your journey. What inspired you to, first of all, study in physical therapy, and second, from private practice turning into a Femtech founder?
Yeah. Well, it started in college. I didn't know what I wanted to do with my life, and I was, right? I was Googling around. I knew I wanted to do something in women's health, but all I knew about women's health at the time was a gynecologist visit, right? And I stumbled across this very kind of under the radar thing of pelvic floor physical therapy. And I was very interested because I had had physical therapy for my knees, ankles growing up, playing sports. But I didn't know that you could, one, that you had muscles in your pelvic floor, and two, that they would need physical therapy. And I saw these staggering statistics about how 1 in 4 women has pelvic floor dysfunction, and especially after childbirth. And I just thought, no one talks about this. This is like a huge issue that affects millions and millions of people. And that was kind of it. I researched PT schools, and I did everything that I could to go there. So that was step one of the journey. I loved treating my patients, but I kept seeing this same pattern reoccur where I would treat my pregnant patients. They'd come very consistently every week to PT. They're getting better. They're feeling great. We'd prepare them for delivery, and we'd make a plan to say, okay, I want to see you 2 or 3 weeks postpartum. It could even be a virtual visit at this time because we're post-COVID, where virtual was like a lot more common. But then inevitably that 2 or 3 week appointment would get canceled, right? And then I either would not see that patient again, or it would not be until they were, maybe like 3 months postpartum. And it wasn't that they were canceling because they didn't need it. They were canceling because they had this newborn, and it's hard to juggle. This little baby has to eat every 2 hours. How am I supposed to figure out childcare, and then like driving to the clinic, parking? And so all the while my patients were suffering with back pain, neck pain, incontinence, and they just couldn't make it work to get care for themselves. And so I thought that, we have technology now and everyone has a phone or a laptop. We have to be able to help early postpartum women with that very special time in their life where they need actually a lot of support, but just like can't easily get it. So that's what kind of made me found Amie. So that is what I'm currently working on doing right now.
Oh, that's very fascinating. So tell me a little bit about, I can definitely relate to that. First of all, I have to say I can definitely relate to canceling the appointments, especially, the first quarter of having the little baby. So it's totally relatable, understandable. But how important it is to follow your appointments within that period?
It's so important for a lot of reasons. So I'll go through first, just for your own physical body, if you've had kids before. I know you have, but your body is kind of a wreck afterwards, and you have to take care of this baby. Maybe you have more than one kid already at home. Your body needs to be functioning properly so that you can then take care of this little baby properly, right? And I kind of explain it to my patients this way, where your body has a certain like threshold of the amount of, for lack of a better word, trauma or injury it can take before that turns into like pain and then chronic pain. So even though you've just had a baby and might not feel like there's anything super wrong right now, over time, those kind of muscle weaknesses could turn into chronic neck pain, right? Or chronic back pain or chronic incontinence. So it's much easier to take care of a problem beforehand than to go months, years and years suffering with it and try to fix it kind of on the back end.
Definitely, yeah. Explain to us, for those of us who have not had this experience, but maybe soon and they are expecting or they are planning, it's always better to know what you're going to experience. So explain to us, what are the most common problems that women usually face in terms of the physical body, and even maybe the impact on their mental health as well, right after the birth.
I think in terms of most common physical issues are the ones I kind of just listed. So back and neck pain, particularly if you're breastfeeding, but even just feeding a baby in general, we tend to be hunched in this position all the time. And then with the back pain, you're having to bend over and lift the baby up and down all the time. And I mean, you know this, those car seats are really heavy and awkward. So back and neck pain for sure, I see a lot. And then the other one, particularly if you've had a vaginal delivery, is urinary incontinence, especially what we call stress urinary incontinence. So if leaking drops or more of urine after you're like coughing, sneezing, laughing, jumping, running, that kind of stuff. And none of those you want to have for like a very long time, right?
Definitely not. So how can physical therapy help to avoid that or, make some improvement?
So one of my favorite things to do is see someone during their pregnancy, right? Because not only can we help prevent those pregnancy aches and pains, but we can also strengthen those muscles in preparation for the delivery so that you're already starting off at a stronger point, right? So we do lots of core strengthening, lots of postural muscle strengthening, pelvic floor strengthening, teaching people what their pelvic floor is, how to work it, right? How to do a Kegel properly, how to relax it properly. It's also a lot of just education of talking about, especially as they get closer or further along in their third trimester, we're talking about breastfeeding positions, right? And like I mentioned, telling people, okay, you're going to be like this a lot. So after you're done feeding the baby, making sure that you're kind of stretching afterwards and like kind of undoing that posture. Talking about baby carriers and like how to lift those car seats in the most optimal way. So it's a lot of physical, but then also mental preparation as well.
Yeah, that was actually, as you were talking, I had two questions. One is what is pelvic floor?
Great
For some of us that don't know, please. And then you also touched on mental health that I would like to ask a follow-up question. But let's start with explaining. This is 101
Yes.
biology. What is pelvic?
Thank you for asking that, because doing what I do, I forget that.
Sure.
I mean, a lot of people don't know that you have muscles down there. So your pelvic floor is a group of muscles that lives on the bottom of your pelvis, and it runs from the front of your pubic bone all the way back to your tailbone. They look kind of like a hammock, and their jobs are to support all of your pelvic organs, so bladder, uterus, rectum. They make sure that you can pee and poop properly, so keeping everything in when it's supposed to be in and letting everything out when you want it to come out. They help us with sexual function. And they also help us actually with lymphatic support too. So we have two big groups of lymph nodes kind of right in our pelvis there. And through their contractions, through Kegels, they help us get fluid out of our legs and up to where it's supposed to go.
Great. So how does it change during the delivery, and is it different from vagina than C-section?
So whether or not what type of delivery you have, you are still pregnant, right? And you have this growing weight putting more and more pressure on the pelvic floor. So even if you have a C-section, your pelvic floor will have still sustained 40-ish weeks of having however many extra pounds on it. So the main difference is obviously with the vaginal delivery, the baby is actually having to go through those muscles, which can lead to some trauma, right? Some people will have some tearing going on down there, and depending on how long you push, that can lead to some extra trauma to the muscles. But I've been seeing a lot on social media, people saying like, oh, just have a C-section, it won't affect your pelvic floor. That's not true, because your pelvic floor is still affected just from the pregnancy itself.
Exactly, yeah. You touched on a very important point, which is one of our mission at Cybele Health. Advice people give in Instagram or social media. So this is very important. Patient education is very important, right? Raising awareness about women's health specifically, which has been taboo and a hush for so many years. Even moms don't talk much about the whole process. I heard on the radio the other day that a girl had her first period while in the bus, and her mom have not had any talk with her about what to do, and she was 30. So raising awareness is really important in so many levels. But what people do, they go to Google, they go to Instagram, they start to follow influencers, people who have more skills on creating and drafting eye-catchy content. Whereas on the other side, we have domain experts like yourself that they can share their knowledge. So that's one of our missions at Cybele Health. We create this online educational platform specifically for women, but not everybody can come and create content there. It's only professionals, certified, like doctors, working in the domain. So it is really important to not believe and follow, everything that you see or read. Make sure that you do some research on the background on who is the person who is giving that advice. Thank you for clarifying that, actually. But my second question was about mental health. So you said starting from even planning pregnancy, going through pregnancy, birth, postpartum, breastfeeding, all of those months and months, our body as a woman is going through so many hormonal changes. And we all know that those hormonal changes plays a major role in our mental health. But I'm really interested to know from your perspective how that mental health changes and differences in moods and ups and downs plays a role in our physical health.
I think they're very much interconnected. I found my job as a physical therapist, I almost wished that I was also a certified licensed therapist, right? Because I feel like people would come with me with their mental health problems too. I think it's really hard. I mean, there's so much. First of all, your body is changing so rapidly. And your hormones during pregnancy are all over the place, right? You also have specifically this hormone called relaxin, that its job is to relax all of your joints in your body so that eventually, if you do have a vaginal delivery, the baby can move out of the pelvis more easily. But that creates a lot of difficulty for people. If your joints are very loosey-goosey, your body is not looking like it used to, you're not able to do all the same things, that can create a lot of problems for some people mentally. And it's challenging. The other part is just this impending life change, right? You're I'm going to have a baby in however many months or weeks. What is my life going to look like? It's they're very much intertwined. And I do find that it's when you're mentally not the same, right? If you're having difficulties, like maybe we're really anxious or maybe we have depression, that makes it really hard to stay active too. And so it all kind of goes back and forth and affects each other, where it's really important to stay active during pregnancy, but it can be really hard to have the motivation to do that if we are not taking care of ourselves mentally as well.
Definitely. And I know that I read somewhere that posture plays a role on mental health and, the way that we respond to stressors. And our career and our profession also plays a very important role on our posture because, for example, I've been a software engineer for so many years, and I've ended up sitting in front of laptop like in this posture for so many hours. Can you elaborate more on that how your career standing up or sitting a lot, impacts your physical health and how PT can help?
I see patients on like the extreme ends of the spectrum, right? So we have a lot of people who sit at a computer all day. And like you mentioned, we all always end up in this like hunched over our laptop kind of position. When you sit like that for 8 hours a day, your muscles in the front of your body get really tight. The muscles in the back of your body get really kind of stretched out. And it makes it even harder to get out of that posture, right? When you're in it for so long and things are tightening in that position. And that's not great because if we are in prolonged bad posture all the time, that's when we can lead to those chronic neck pains, chronic back pains, all of that kind of stuff that we don't want. On the flip side, if we are doing a job where we're standing all the time, so like teachers, that comes to my mind a lot, you can start getting a lot of back pain, right? And a lot of like foot and ankle pain because you're standing all the time. You end up finding these kind of weird postures to like help you out. And think about gravity. When we're standing all the time, our pelvic floor is having to work all that time that we're standing. And so there's a lot of challenges that come with that. And I'm thinking particularly of when all those women go back to work, right? So if you're someone who works at a computer, you're going back to work after you've had a baby. Your posture is already here. Now you've been breastfeeding for how many months? So it's just like everything is like putting you in this position, creating more pain and more difficulty for you to get out of it. And then same with that standing, you go back to work and your pelvic floor is maybe not as strong as it was before. Now all of a sudden you feel like you have to wear a pad to work, which is not great for our mental health, right? We don't want to be like young and healthy and having to wear a incontinence pad to work. So again, I feel like all of these things are so interrelated.
Yeah, and at the same time preventable, right? With the right routine and consistency. But that's difficult. It's really difficult. I can imagine like myself, especially when I had my second one. I had a little one. I had a baby. The maternity leave was 3 months, which was still, compared to some companies, bigger than what 4 weeks or 8 weeks that they had. But compared to what my body really needed was nothing. I was still not able to do that. So my question is that as someone who has been through this process, I know that you're a mom too, and as someone who has the expertise knowledge that how important it is, how did you manage to do that? Because especially those first 3 months that you mentioned, you see a lot of cancellation. It is really difficult to put anything other than the baby's need in the schedule. One, because of the frequency of their needs. So I was like breastfeeding and pumping because it was not enough. So I had to pump. Or baby didn't latch for the first 2 months. So I had to do both. And then I had a little one, and it was obviously pandemic. I had less help. So, but even without pandemic, it felt like if I'm not doing something for baby, it's like I'm selfish, something like that. It really felt like that. So what is your advice on how to manage this, how to work what was your secret sauce on being able to fit in a consistent routine and activities, going to these appointments, not cancel it?
I also suffered from an extreme amount of mom guilt, right? Yes. Like, I think we all feel that. I wasn't perfect, I will say that. Before I had my daughter, I was one of those people who was like, well, if my workout is not going to be 45 minutes, then why am I even bothering? Like, it's not worth it. But you don't have 45 minutes in a row when you have a baby, right? And so what I did is, like, really had to shift my mindset and say, like, okay, I'm really struggling. Like, I had some urinary leakage and I felt like heaviness in my pelvic floor. I could tell it wasn't as strong. And I was having a lot of just like body aches. And I was like, okay, I know from my job that if I just ignore this, it's not going to go away. And so I had to do something about it. I planned with my husband. He was working from home again because it's a pandemic, so that was really helpful. Like, if he wasn't working from home, I don't know how this would happen, but I made sure that I scheduled my PT appointments and I would tell him. I did all of them virtual, by the way, because that was the only one I was going to make it work. And he would take the baby for those, 30 minutes. And then outside of that, I would set an alarm for myself. Like, okay, I'm going to do my PT exercises for 5 minutes. She's supposed to go down for a nap, so I'll do it then. Or whenever she did tummy time, I would do, and tummy time with a newborn is like 2 minutes. So I was like, okay, I'll do one exercise while she's doing her exercises, right? So it was really shifting the mindset of, like, you don't need to do everything all in a row. It doesn't all have to be perfect and like super intense. But that was the only way that it was going to work in those early days. And it was really hard, but I did it. And I feel like that's what I try to tell a lot of patients to do, because I feel like that's the only way it's going to happen.
So what I heard was making that a priority, talking to your circle or family and friends to be supportive of you. And it's okay not to be perfect. Yeah, you don't have to do everything in one row. So you mentioned something interesting. You said you had PT appointments, and you are a PT expert in pelvic floor. Why did you need to go to the, another doctor for your own?
Well, I'll speak for I am someone who needs that external motivation, right? I am the worst patient. I know what I'm supposed to be doing for myself, but if I don't have anyone to be accountable to, I'm not going to do it. Right. The other thing was, I can, there's certain things that you just need an expert for, I had incontinence, but I was trying to assess my pelvic floor myself, and it's just hard to know 100% what's going on within yourself. And it was nice to, whenever I actually could, I think I did one in person eventually, it was nice to get that reinforcement of what I thought was going on was actually going on. But yeah, I think without that, someone making this program for me, that was the other thing. The mental load was I don't have time to make myself a program, right? I want someone to make it for me. And then I think I saw her maybe once a week or once every other week. I knew okay, she's going to ask me if I did my homework. So that was what I needed, was that kind of external reinforcement and support.
That's actually very important, because for me, especially on the second time, I thought I know everything this time. I learned my lessons. But then that mental load was so heavy. And it's not comparable when you have your second one, because still have another kid that she or he needs also your attention. So it was a lot of mental load that I didn't consider before that. And so it took me some time to realize that I have to go again. And each pregnancy is different, each delivery is different. So yeah, definitely need to prioritize that and consider that. Okay, so talking about that mental load and not being aware of that, in my personal experience, what other misconception out there you have seen like women have about their postpartum recovery and making that a priority, and that's the impact of it on their health, mentally and physically?
Yeah, I think there's two really big misconceptions. The first one is that your body is going to bounce back to its pre-pregnancy state, right? That goes back to all the stuff on social media and like celebrities who look like they haven't had a baby, like 2 weeks later. I hate them so much. And it kind of goes hand in hand with my second one, but your body is not going to go back to its pre-pregnancy state. It can't. It has been pregnant and it has birthed a baby. And so I think kind of, again, switching that mindset about like, we can lose the baby weight, that's fine. We can get stronger. But what we need to do is make our post-pregnancy body functional and work for us. And that means, not having pain, not having leakage, being able to resume sexual intercourse without pain, all of these things. It's not about whether our tummy is like tight again, right? So that I feel like is the biggest one where people are like, I had the baby 3 months ago. Why do I not look like I did back in college? It's like, well, we might not look that way again, and we have to kind of be okay with that. The second part is most women have 1 6-week postpartum appointment with their doctor, right? And at that time, the doctor checks you and says, all right, great, you're cleared for sex and you're cleared for exercise. Now, this is not the doctor's fault. They're not trained in musculoskeletal healing and all of that. But a lot of women say that and they're like, all right, great, I'm just going to go back to doing what I was doing before. But 6 weeks, those 6 weeks between birth and when you saw your doctor, you didn't do anything to prepare to go back to that kind of exercise that you were doing. And so you're sort of setting yourself up for injury, basically, if you just jump straight into whatever you were doing before, right? So let's take like yoga or Pilates. If you just go back to your Pilates reformer class and your core isn't back to what it used to be and you're on the reformer, you're just setting yourself up for injury. So what I try to do a lot, and a lot of my other pelvic floor PTs do a lot, is teach women that you actually can start exercise, but it's more like muscle reactivation in those 6 weeks before you see your doctor, because or else you will have just sat there with your muscles kind of atrophying for a month and a half. So we try to do a lot of education on, there's some really gentle core work, there's some really gentle glute and hip strengthening stuff that you can start to do so that you're building that foundation so that when the 6 weeks comes, you can start to gently and slowly go back to what you were doing before, and you're setting yourself up for success that way.
That's great. Yeah, I totally agree with the mindset. You touched on a couple of things. One was like losing the baby weight, which is like always, I think that the top of I have to lose this, I have to lose this, especially with the social media. And I know that like genetically, or based on your genetics, the rate that you can lose baby weight is very different. Yeah. But making that a norm that you have to do this, unfortunately, it plays a very major role on our mental health, physical health, rushing into things. That's maybe it's too early, our body is not still ready for that. Yeah. So can you give us some timeline of when to see the PT, when it's time to see the trainer? Yeah. And how are these two different? And can PT also play the trainer role at the same time and help you lose weight so you don't need to go to the trainer? Or
yeah, It's a great question. So I always want people to see a pelvic floor PT within like 2 to 3 weeks of delivery. And then depending on what's going on, I typically say 1 visit at 2 to 3 weeks and then 1 visit after your 6 week, like after you're cleared. Because what I'm going to tell you to do at that 2 or 3 week visit, hopefully by the time you're cleared, we will be able to progress and do like real exercises. And so I would always tell people it's my job to sort of get your muscles functioning properly so that you can go to the trainer or that you can go to your boot camp class. And that's me personally. I know there are some PTs who are also trainers, and so they could help with that weight loss process if that was what they wanted. But for me, I would always tell patients that's not my expertise. So typically if someone has, done all the work, they've done their foundational core work, they're not leaking when they're doing basic things like squats, lunges, jogging is hard. But if they can do those basic things that I know they're going to do at the trainers, then I'll say, okay, great. Now you can go to the trainer and just make sure it's someone who has worked with postpartum women before, so that they understand that, you might not be able to do like whatever 10 sprints, that we're going to start with some other stuff first. But typically you can start doing that fairly early on as long as you don't have any issues. But it just depends on, everyone's body, and recovery and pregnancy is different.
Sure, yeah. So there are also lots of apps and digital tools to help women, especially for postpartum. How do you see that fit in with this picture, and how much do you think that those digital apps or digital tools can help women either to replace the PT visits or limit that, or do they need that, or is it like a supplementary? Can you explain a little more?
Yeah. Well, so this is kind of the reason why I started Amie, because pelvic PT is not very accessible to most people. There are only, I'll put it into perspective, 3.6 million births happen every year in the US, and there are only 10,000 pelvic floor PTs, and 80% of those do not take insurance. So even if you live in an area that has a pelvic floor PT, chances are that visit is going to cost you between like $200 or $400 each time. And pelvic PTs, we always have wait lists because there's just not enough of us. And so there's just a lot of barriers to going to an actual PT. So that's where I think those digital health apps are super important, because it helps increase the accessibility. So in the case where you can actually see a PT, this would happen with my patients all the time. They could see me once, but maybe they couldn't get in for another month. Okay, well, use this app then to help keep you progressing until you can see me the next time. And I'm talking about those external cues, right? Sure. If I don't have an actual PT to report back to, that app is going to want me to check in every day, right? And I can see on there like, ooh, okay, I didn't do my exercises yesterday. I better make sure that I do them today so that I can, check it off the list there. And that was part of my vision with Amie, is there's all those logistical barriers about there's not enough PTs. A lot of them don't take insurance. They're expensive. It's hard to physically get yourself to the PT office. So I didn't want any of those to be an excuse, right? So with Amie, I don't say that we're replacing a PT, because I don't think you can ever replace that, one-to-one healthcare relationship. But what it can do is fill in that gap. If you are unable to go to a PT, you'll have this app here that can do a lot of what a PT does. Assess yourself, get you started with an individualized program, keep you accountable, right? Track your progress. And there are a lot of apps out there like that, and I think that's great. The more that we can help women in this period of life, I think the better.
That's great. Like, making yourself accountable, tracking your progress. Even sometimes I simply forget what was the routine.
Yeah.
Or there are so many details, especially in doing physical activities, like the angle has to be this and not that, your posture has to be this and not that. So, having that in an app that can remind you exactly what was your routine, but also having access and providing probably some feedback from your special physical therapist, not just everyone, because building that patient relationship is also important, building that trust. And I think that definitely apps can help, especially as they say, health happens between sessions.
Yes.
And currently there is no visibility of providers into their patients' routine and how well they are following their routines. And if there is need to be any adjustment, especially when the between visits, it's like a month or 2 months, we are speaking about a really good period of time. That's also our top priority at Cybele Health, to make that accessible to the providers who have that visibility into the patients. But what sets Amie apart from the other platforms? What is so much unique about Amie that you are so proud and excited about?
Well, a lot of them are not actually founded by PTs. There are a couple. So that's one thing that I'm very proud about. The other thing is that I haven't seen any out there. I know there are a lot, but I haven't seen any of the big ones out there who have done what we're doing to help make the programs truly individualized to the person. So a lot of the apps out there, they will have, a 12-week program, but everyone gets the same program, right? Everyone gets the same week 1, week 2, which can help some people. But what I found in my practice is that some people might get left behind, right? Like if they didn't even get the foundational week 1, but now they're getting just progressed through the system, they'll end the 12-week program and be like, well, I still have this issue.
That's again the one-size-fits-all approach that
Yes.
doesn't.
So what I created at Amie is, it's kind of 2 parts. There's a questionnaire, certainly, that asks you certain things that we need to know about, like your activity level and like how did you deliver, all of those things, which I have seen one other app do. But the other part that's really special is that we have them do a physical self-test as well. So we have them do certain exercises, and then we ask them questions about like how that exercise went for them. And through that, we're actually getting that, I don't want to say, like real physical data about, because someone can say, yes, exactly. Because someone can say like, oh yeah, I'm really strong, or I'm really active. But you'd be surprised, like, especially after a baby, when you try to do a squat or something, like it can be humbling. And so really getting people the correct exercises that they need for that moment in time, I felt very strongly about. And I didn't want women to have that experience of just getting kind of shoved through a program that wasn't really tailored to them.
That's very amazing and very in great need for that, definitely. Thank you for doing that. Is there one final advice, because we are almost running out of the time, that you want to give to the women, especially those who are early in postpartum, about how to take care of their health, or any piece of advice that you think that would be great?
I mean, I think we kind of touched on it already, but I think it's so important is to really make it a priority to do something for yourself, especially in those early days. And like I mentioned, it doesn't have to be 30 minutes, 45 minutes. It can literally be 2 minutes. It can be 5 minutes, right? Even just like going outside and like standing in the sun for a while, or doing 1 or 2 exercises, doing a short little, I like lived on the Peloton meditations, the 5-minute ones, just something, because everything else in your day is about the baby. And so you can take, 0.5% of your day to do something for yourself. And that is going to help so much. And if you're someone like me who literally needs to like put an alarm or like make a calendar event, like just it takes a little bit of extra work to figure out how that works for you. But once you figure it out, I would say plan it and stick to it. And I think that they'll find that they feel better because they will have done at least 2 minutes of something just for them each day.
Definitely. And that goes a long way. If you stay consistent with that, that goes a long way and makes that habit, right?
Yep.
So that's great. So how can they find Amie? Have you launched yet, or when is it, or where is it accessible?
We are still pre-launch, but if you would like to sign up on our wait list to know when we do launch, the website is askamie.co, or you can find us on Instagram at the same name, ask.amie or askamie.co.
We'll put the links on the comment section. So
Yep. Or on TikTok.
That's great. Awesome. Thank you so much, Amie, for joining us. I really enjoyed our conversation. I know that so many of our postpartum women also learned a lot of new things about it. I appreciate your time. And find Amie on TikTok and Instagram. Join the wait list. And you will find so many valuable information about it. Do you have any final words?
No, just thank you for having me. I'm excited to hopefully get some new folks on our sign-up page.
Sure, yeah, we will. Thank you for joining us and for listening or watching this episode. Please share that with your friends. Subscribe to our channel if you found it useful. And leave us some comments on what other topics you would like to talk about it in this podcast series. And I also appreciate your time. Until next time, take care of yourself.